Interested in all things psychology? You are at the right place. Here, we bring exciting and thought-provoking ideas. We travel into our minds and some things out of this world. Welcome to the Psychology Debrief.
Hi, and welcome back to our second episode on Clinical Doctorates. I'm joined today by three of our trainees, Anne, Tilly, and Malcolm, who are going to talk to me about sort of an insider's view of what a clinical doctorate is like and how they got onto the process. So I guess one of the things that is probably quite useful to start off with, and it's something that I explored in the other video I did with Michael Evangeli, was about the application process and what necessarily universities are looking for when kind of scanning applications from people like yourself. And he obviously talks a little bit about certain things that the university is looking for. But I'm wondering if maybe each of you can just give me an outline of sort of what your background is. So what did you do prior to applying for a clinical doctorate? So maybe what kind of work experience did you accumulate? What kind of degrees did you do? Maybe it might vary quite differently across the three of you. It might be quite similar, but I think maybe it'll be quite good just to kind of get a bit of an understanding about what your background is and how you felt that fed into it, how you applied to the clinical doctorate. So why don't we start with Tilly? Why don't you tell me about what you did prior to coming to do the clinical doctorate at Royal Holloway?
In terms of education, I did my undergrad in psychology at Royal Holloway, and then I did my master's, and then I did about 5 years kind of work in between. So I actually started off quite a researchy role. I worked across several big research projects involved kind of mental health, sort of a more psychology application. And then after that, I kind of transitioned into a more clinical role for 2 years as an assistant psychologist, focusing mainly with children with learning disabilities. So yeah, all my experience was pretty child focused, I would say. And then, got on my second application to the doctorate.
So you weren't successful in your first application, but in your second one you were. Was there anything particularly you felt like you did differently in your second application that might have helped?
I think it was just experience. I think the first time I applied, I'd only had 1 year of clinical experience. So I think that extra year just let me get a lot more clinical experience, a lot more kind of range of what I was doing, which then obviously fed into my application in terms of what I could say that I'd done and what I had experience in. And I felt a lot more ready as well in the second one because I'd got that extra bit of experience.
And what about Anne and Malcolm? Is your kind of background into coming to this clinical doctorate similar to Tilly's, or maybe do your experiences diverge? Maybe Anne, do you want to speak a little bit about how you came onto the clinical doctorate scheme here?
So it's quite similar in terms of education to Tilly. So I did my undergrad and a master's, but back in Germany. So I did quite a clinical master's quite a while ago as well. And actually I ventured off a bit and did quite an academic role in a charity. So that was in environmentalism, so totally different topic, still quite psychological in terms of behavior change and kind of more health psychology stuff. But that was me doing other things. I was an event manager in between as well. And then I had my son. So there was quite a big gap before starting to work in the NHS and moving to the UK. I had quite a bit of clinical experience in Germany. I did lots of placements and internships. I did like a gap year. So I always tried to squeeze in kind of smaller bits of clinical experience, and did a research assistant role, quite a few in Germany as well. Then had this big kind of break from clinical psychology and came back to the NHS then. And actually at the time of applying, which might be helpful to know, I only had that 1 year of NHS clinical experience. So that doesn't mean if you don't have many years of NHS work under your belt that you can't get in. So I was lucky to get in the first time I applied. So I had about 2 years of older adults NHS experience by the time I got on the course.
So what I'm kind of getting the sense from both listening to both of you is, first of all, you both did quite different things. And you mentioned about doing kind of research in sort of environmentalism. So not necessarily all the kind of experience that you might accumulate has the kind of direct clinical relevance, but is going to necessarily show the kind of skills that you're going to need on a clinical doctorate. But also, it seems to be more than just you got an education, you went out and you did various different placements and other kinds of work outside of the kind of higher education setting. So you didn't necessarily just do an undergraduate and master's, you went and did a lot of work experience to kind of suit or provide a platform rather to applying to the clinical doctorate. I'm wondering, Malcolm, is that a kind of fair summation of your experiences as well? What was your sort of background coming into a clinical doctorate?
Yeah, so I'd say I'm somewhat similar, especially in terms of education. I guess, so I was born and raised in Hong Kong, and then I moved to the UK a number of years ago. So I did my undergrad at Exeter and then a master's at King's. And it was sort of at King's when I really felt like, oh, this was a career that I really wanted to pursue. Was able to get some placements working in secondary and tertiary mental health settings in the NHS, thanks to my master's as well. But I guess what's different is after education, I didn't hold any like substantial research roles. So I see myself definitely as a more like clinically oriented person, I guess. So right after master's, I moved into 2 different assistant psychologist roles. First of which was in a complex care / psychosis rehab team. And then afterwards was in child and adolescent mental health. So yeah, somewhat similar, I'd say, but seems to be some differences between all 3 of us as well.
Yeah, and I'm kind of thinking maybe there's a question that maybe some of our viewers might be having, which is obviously a lot of your kind of background experience comes not necessarily just from the teaching you had in higher education. You all have done undergraduate and master's degrees, but you've got this extra work experience. And I'm kind of wondering if you have any advice for someone who's looking to get that kind of work experience. Obviously, you've all done quite lots of different individual things, and some of you may have done more than one, but how did you find these kind of work experience? Was it something that your universities helped you identify, or did you do it kind of entirely separately? How did you come across the work experience that you've accumulated?
I'd say, I mean, I think a big part of it as well is just taking every opportunity you have. I mean, when I was doing my undergrad, I worked as a research assistant in my 3rd year for one of my lecturers. And that, was just a chance that came across and I took it. And then I think, after I'd done my master's, when I was kind of more in a substantive role, again, it was just a case of kind of taking chances that pushed me closer to getting to that sort of clinical aim, I guess, and, taking things that I thought would give me the experience that I needed. So yeah, my kind of biggest piece of advice would just be take up any opportunity that comes your way, and look out for those little bits, because they all add up, little bits quickly add up into a year and 2 years.
So let's talk a little bit about the actual scheme itself. All at the sort of end of your first year now. In your first year, you have sort of teaching related elements in your clinical doctorate scheme. Maybe you can just give a bit of a brief overview as to what you've kind of covered in your first year. What actually is involved in the teaching side of things? What are you learning? Maybe Anne, do you want to talk a little bit about what you've kind of covered so far in your first year in terms of the teaching component of your degree?
Yeah, I think it was quite varied, a lot more varied than I expected it to be. We had quite a lot of kind of standard modalities teaching, like psychodynamic, lots of skills around CBT, because that's kind of the main focus of the course, but there were also some bit more niche lectures, like about, well, not niche, but kind of schema therapy or CAT, so that's been quite interesting to learn about that. And I was just kind of going back in my mind about like what we did in the beginning, because I almost forgot like how much teaching we actually had on kind of more kind of meta skills, so like or supervision, or how to speak to clients, what's like BPS guidelines. So especially in the beginning of first year, I think there was a lot of kind of teaching to get us all on the same level in terms of what is the role of a clinical psychologist and these sorts of things, which I didn't expect. So that was quite helpful.
And I'm wondering, I think when everyone's here's teaching, there's the open question about assessments that kind of rears its ugly head. I know most people are quite nervous about assessments in educational programs. Are there assessments related to the teaching components that you've had? And if so, maybe you can just kind of give a bit of an overview as to what kind of assessments you've had in your first year.
Yeah, we do have assessments. Just trying to think back over them now. I think in our first year we had one essay. We have had one kind of research assessment where we've kind of reviewed a paper. We've also had to do one case report. We have to do 3 over the 3 years. And we have an exam coming up in a couple of weeks as well. I don't think I've missed any assessments that we've had this year.
I guess we had 2 presentations on clinical cases as well.
I mean, I was going to say, it sounds like, although there are assessments, they are quite sort of your kind of typical bread and butter for how you're assessed in educational purposes. So essays, presentations, exams, that sort of thing. So I suppose anyone who's a bit worried about how you get assessed, you know, they are quite typical ways of assessing. So you're probably familiar with having written an essay before or done a case report and that sort of thing. So also doing a placement in your first year as well. So all of you are currently working within the NHS doing a placement, which is obviously a key component of a doctoral training program, is you actually get that hands-on experience in a mental health setting. Maybe you can all talk a little bit about what you're currently doing as a placement. And also when you kind of outline what you're doing, I think it might be quite interesting to talk a little bit about what you expected coming in. What were your kind of concerns and worries, and maybe is there any kind of advice you might give to someone who's sort of starting out their first placement? Malcolm, do you want to start first talking a little bit about what kind of placement you're currently doing?
Sure. So I'm currently in a primary care mental health setting. So it's called, it's an IAP service essentially. And I guess the premise or the kind of defining characteristic of primary care mental health is you see a lot of breadth. So you see a lot of different mental health difficulties that people present with. And it is a psychology or therapy only service. So it's very therapy driven in terms of the work I do on placement. The vast majority of the stuff I do is just like the one-to-one work, like seeing clients for assessment and therapy sessions. I kind of went into it like quite nervous because I've never worked in primary care before. I've come from work experience only in secondary and tertiary. So I've always known that it's very different in terms of like the way of working, especially in the kind of dynamics and kind of organizationally how it works. So I would say, you know, try to go into it with an open mind, regardless of sort of what preconceptions you might hold, and, you know, treat it as an experience to, you know, get some exposure, especially if it's a new kind of setting that you've never been in before. There are, you know, lots to learn everywhere, like regardless of what placement you're allocated to. So I guess, yeah, that's my experience of things so far.
And Anne, what about you? What are you currently doing as your placement? And have you got any advice for those who are about to start their placements?
Yeah, I'm in a secondary mental health care service, quite a specialist service for depression, anxiety and trauma. It's a very busy service, and yeah, I'm enjoying it very much. Similar to Malcolm, I actually never worked in primary care, so I'm always in the secondary ones. But then even this one is again very different from the secondary service I was working in before as an assistant psychologist. So yeah, just to stay open-minded is quite good advice. And I think for me what was helpful was to really recognize the difference in working a full-time role, like most of the assistant psychologist jobs, versus 3 days, because 3 days on placement are quite short. And someone gave me advice in the beginning to really manage that time wisely, also in terms of boundaries, or knowing like what projects to take on and whatnot. It's not always that easy, because especially when you start placement, lots of people in the team throw things at you and everything sounds really exciting and you want to get to know the team and your supervisor, of course. But yeah, realizing that 3 days are quite short, and maybe you don't have to write the minutes of the business meeting necessarily on top of all that. That was good learning for me.
And Tilly, what about you? What are you currently doing, and any advice for those who are starting their placements?
So I'm also in a primary care service. I'm in a staff support service in a big hospital in London. So again, like Malcolm said, lots of kind of breadth. a lot of focus on the kind of individual therapy, but I also do group work and some sort of workshops and kind of teaching for teams in the hospitals as well. Kind of a bit of a range of therapy types as well, kind of quite a lot of CBT, but some opportunities for psychodynamic and sort of ACT and other things. In terms of advice, I think I was very nervous going in because I'd never done any kind of substantive work with adults one-on-one. Like I said, my experience was mostly children. So I felt like I was being thrown in the deep end a bit. But I think, you know, recognizing that no one's got experience in every single area. We all have different kind of experiences behind, so we don't have to know everything. And knowing that we are training, but we're also learning. You know, our supervisors are there to support us and teach us as well. And that, you know, was something that was really beneficial at the beginning. Settling in is kind of having that support around you.
Yeah, I mean, it sounds like there's a running theme here that all of you are doing something which is a first time. And, you know, it's always a scary process to do something for the first time. You always have a lot of doubt about whether you can do it. I mean, from my own personal experience, some years ago, I started out teaching for the first time. And, you know, there was a time where it was my first lecture or my first class. And it's always a really, really scary process. And obviously it seems to be the same thing for you guys going through the clinical doctorate scheme, starting your placements often in very new settings, doing very new different things. It can be very, very scary and daunting. But obviously, as you've all outlined, you get a lot of support. It's not like necessarily they just throw you in, off you go, deal with this. You get a lot of support whilst you're there and a lot of help along the way. So very finally, you only actually really have just started this kind of component of your degree. As you go throughout, you start to turn your head more towards the kind of research aspect of your degree, your thesis. You actually yet haven't started that aspect. I believe you've just gone through the process of identifying and selecting your supervisor and research area that you want to investigate for the next sort of 2 years. So obviously right now you don't really have much that you can say in regards to that, but maybe in a couple of years' time we can have you all back to talk a little bit about how it was, any advice that you might have for someone who's going to go through that process of conducting research and writing a thesis. But maybe a good thing would be just to finish off this video with just a brief snapshot as to what you're planning to do. So maybe if you can just go around and just briefly outline what your kind of area of research that you're planning to investigate is. Maybe we should start with Malcolm.
Sure. So I'm going to be doing a thesis around a VR intervention for children with chronic pain. So yeah, I think it's really exciting. I'm really looking forward to it. Very much still in the works, as you said, Sam, kind of in the beginning kind of stages of things. But yeah, looking forward to see how it goes.
And what about you, Tilly?
So again, very early stages. I haven't pinned it down exactly, but it'll be in the area of looking at how process thinking and outcome thinking affects a certain population, or if there's anything we can do to help that. Sort of outcome thinking being thinking about a goal you want to achieve, and process thinking being how thinking about the steps you've got to take to get there. So looking at that.
And yourself, Anne, I must admit, I do know what you're doing, given that I'm your supervisor, but give it a shot anyway.
Yeah. So I'm going to be with you, Sam, obviously, and yeah, we're going to look into the area of death anxiety and terror management theory, and yeah, we're just in the process of figuring out, I think, which area we want to connect it to. So kind of I think we're looking a bit around body image and body dysmorphia, or also kind of pro-social behaviors among humans or towards animals as well. So still quite open, very early stages, but I'm really excited. Yeah, and lovely to hear how varied the topics are just between the three of us, actually. Yeah, it's been...
Yeah, I was going to say the same thing. It's amazing to see the diversity in what you're all three are going to plan to investigate. I'm just wondering if maybe you can talk a little bit about how much kind of choice there was in regards to what you were able to research. You're all doing very, very different things. Sort of how much sort of options were there available to you?
Yeah, so there were loads of choices. I think it probably covers everything, you know, the whole breadth of kind of disorders and populations and things like that. We got given, you know, lists of all the available projects, and we got to speak to all the different supervisors that we were interested in, and then approach the ones that, you know, we wanted to do. I think I didn't have a specific area of mind coming into it. I was quite open, and yeah, I found it really difficult to choose. There were lots that were really interesting and sounded like they'd be really good. So yeah, you know, what I liked about mine is I can kind of tailor it a little bit to what I want to do and kind of design it a little bit myself. But there's, yeah, loads of choice, massive breadth.
Well, thank you for all of you for giving your experiences into what the clinical doctorate has been like so far, and also your kind of background experience and how that helped you get onto the clinical doctorate scheme. I'm just wondering if we can just finish up with maybe just going around with kind of one lasting kind of piece of advice to anyone who's thinking about applying to a clinical doctorate. What would you give them? So maybe starting with you, Anne, what would be your kind of one key piece of advice that you would give?
Yeah, I was thinking about that yesterday, actually, in preparation. And I know it sounds quite cheesy, but and it's repeated often, but I think really kind of not to hide your skills and your own story, even if they're not related or kind of directly related to psychology or clinical psychology. A lot of things kind of feed into psychology and the skills you need to get on the doctorate. So really kind of bringing as much as you like and feel happy to kind of share from your personality, but also maybe experiences you gained outside of psychology or outside of the workspace, even, that might help you reflect better, become a better psychologist.
What about you, Malcolm? What's your one piece of advice?
Oh, I have to say, Anne, you kind of, I was going to say something along those lines. But yeah, I'd say, you know, be like quite reflective and also like very open-minded in terms of how you approach like the application. It can be a very challenging and disheartening process. So I would say, you know, try to like think about like the meaning behind it for you and why you ended up deciding, I want to pursue this doctor, I want to pursue this career, and try to use that as a bit of a motivation to keep you going, and bearing in mind that, you know, clinical psychology needs like a diverse range of people from different backgrounds and perspectives, and just try to harness that within yourself. Consider like, oh, how might you see mental health care different from like the other person? How might you kind of you know, practice, or how might you be like individual and unique as a clinician yourself, and just thinking about how all those things can translate into your application, just to show them who you really are.
Brilliant. And Tilly, very finally.
I think persevere, like Malcolm said. Sometimes it can be a tough process, but I think also enjoy what you're doing to get on. Don't just see it as, you know, something you have to do a tick box exercise to get onto the doctorate. Enjoy it, learn the experiences from it, and yeah, just keep going.
Thank you for watching the Psychology Debrief. If you have any suggestions for new topics, quizzes, or any other content psychology related, feel free to get in touch via email or Twitter. Don't forget to like, share, and subscribe. Bye!